Hi, we're here with Dr. Nguyen today, and we're going to be talking about the optometrist career. And we'll start with what are the goals of this career?
Sure. So just kind of a preface. So I'm an optometrist practicing locally here in San Jose. And so in terms of what I do and the goals of the career, so I think if you ask anyone in the medical profession, they are going to say the goal is to help people, and that really is the matter of the fact. So our goal is to really help people see clearly. I think there is a misconception that optometrists are primarily just there for glasses and contacts, but we are actually doing a lot more. And so, we are diagnosing and managing a lot of eye diseases, and we try to help people learn to take care of their eyes as well. So, just kind of give you an idea of the diseases and the things that we can catch. Just I'm a relatively new graduate from optometry school, but I would say even then, in the past few years, I've just by looking at the eyes, I've caught diabetes, I've caught, you know, very high levels of blood pressure, causing swelling in the eye. I've caught strokes, sickle cell anemia, multiple myeloma, cancer. So these are all things that can show up in the eye before anywhere else in the body, really. And then so um, really that is the goal of the career, that you're able to not just help people see clearly, but be able to catch any sort of other disease that maybe hasn't manifested anywhere else in the body yet. Other than that, I would say another goal is to really just build relationships with your patients. And that's what I really love about optometry compared to some other professions out there. Sometimes it's hard because your patients can be coming to you, in a lot of pain, or or so yeah, in a lot of pain, or they're angry or something. But typically when you are in a private practice setting for optometry, you know you end up seeing your patients for so long. They come back every year, and as you grow with your patients. So then, by the time that you're 40 or 50, you start to see your patients' kids there. You start to see their grandkids as well. And so that is something I would say is relatively unique to optometry, and that's one of the things that actually drew me to this career.
That sounds awesome. I think that's a pretty good part of your job, getting to develop that relationship over time. And I think that's pretty unique to optometry. All right, moving on
Mhm.
to the next question. How would you describe the work-life experience? Like on a typical day, how would you describe your life as an optometrist?
So I would describe my life as an optometrist as very interesting. So what I like about it is just, every day is different. There's no 2 days where it's the same. And that's because, you're meeting, either completely new people or patients who you've seen every year for a while now. And so, I think the interactions are kind of the bread and butter of this profession. So I think, I had kind of established long ago. I had tried a desk job before. I realized that wasn't for me. I like kind of thinking on my feet. And then so, like I had said before, we are doing glasses, contacts, but we're also doing a lot regarding the health of the eyes as well. And then so, you really get to use your brain throughout the day. And, sometimes things just pop up. Sometimes there's like an emergency case as well. And so that is something that I really like. And so that's how I would describe the work life. So it's just different every day. So you never really get bored.
Yeah, I agree. The desk life is not for me. So, and there, I appreciate learning about careers, which you do something different every day. Like obviously, everyone does something at least a little bit different every day, but that kind of complexity is kind of hard to find in a
Yeah.
lot of jobs.
Yes. And it's very nice because, you you can really see just a whole range of patients. We can prescribe glasses for, babies as young as 6 months old sometimes. And then other times you're seeing someone who's like 90. And to be able to meet all these different people, and then, from all these different walks of life, and really experience that with them, it's really great.
So going off of that, I think we've discussed a little bit already, but what drew you to this job, and or how did you get into optometry?
Sure. So So kind of a little bit of background. I went to UC Irvine for undergrad, and then I majored in public health. I originally wanted to actually be a pharmacist, but you know, during those college years, I really think it's kind of the best time that you can, shadow different professions and try to figure out exactly what fits you the best, right? Because there are a lot of good careers. I think every career kind of has its pros and cons, but you have to find what works best with your personality. And so I found that pharmacy wasn't necessarily for me because you do have a very important job, but your interactions with your patients are relatively limited, right? I felt like um, you are behind the counter a lot. You have your consultation, it's maybe 5 minutes max, and then you're done with the patient after that. And so that kind of led me to think, hey, where do I want to go with my career? And so I had looked into pretty much every sort of um, pre-medicine club that was out there. So, looked at nursing, I looked at physician assistant, I looked at, medical school, neuroscience, everything. And so in the end, what drew me to optometry were a couple of things. So one that I keep mentioning is the patient interaction. I like how when your patients come in for an optometry exam, for the most part, they're happy to see you. They're not there in complete pain, and they're not just having a tough time. I particularly wanted a profession that was what I call clean. Like, I'm not very good with blood, and so I knew I didn't want to be a surgeon. So kind of the counterpart to optometry is ophthalmology, and they do the surgeries. And I like being the kind of the primary care physician of eyes and not having to deal with all of that. Um, Other than that, I liked the idea of the length of schooling. So for optometry school, after your undergraduate, just assuming you finish all your prerequisite courses that you needed for school, then you're doing an additional 4 years where you focus on the eyes, and that's it. You have your doctorate degree. After that, if you want to do a residency and specialize in something, you can, but it's not necessary technically. And I feel like for the most part, doctors, after they do their 4 years, they're good to go. They have a very solid foundation. And so that's compared to medical school, where you do your 4 years afterwards, and then if you want to specialize in something, you're probably looking at another 4 years or even more. And I didn't want to use so much time and accumulate so much debt. um, let's see what else. So other than that, I like the flexibility as well. And so with optometry, at least in private practice, if you own a private practice, or in general, it's a small business, so it tends to be relatively flexible with schedules. And so it was kind of evident too with like our graduating class. So we had about 80% females and maybe 20% males, and a lot of times you do hear that with women, they like this job because of that flexibility. So if Fridays are when your son has soccer practice, right? Then you can choose not to take that day for work, and then you can just work the other days. You can kind of choose your hours for the most part. And so I think as someone who wants to start a family, knowing that in the future that's going to be an option is very nice for me. And lastly, I would say job stability as well. So there are always going to be people like you and me, clearly, who need glasses, right? So there's always going to be a need, especially now with the baby boomers and everything. There's going to be more need for glasses, more need for people to manage and treat eye diseases that come with age as well. And so, you know, recently I feel like there's kind of been a pop-up of more of those online eye doctors, where they kind of use specific technology to kind of try to gauge what your prescription might be. Is it accurate? Maybe, like, we don't really know, but can it really look in your eye and check for different diseases? That we know for sure it cannot. And then so I think there is a lot of job security going into the future with optometry.
Especially with everything nowadays being online, that probably has a toll
Yeah.
on people's vision.
Yeah.
think that was a great answer, and I think that would give students pretty clear like motivations for pursuing this career. So you were talking about specializing after you go to optometry school. So
Mhm.
what kind of specializations are within optometry?
So there's actually quite a few. So depending on what you choose to do your residency in, I would say that the most common one is going to be one in ocular disease. And so, we are um, by default when we graduate, we're able to treat diseases like glaucoma and everything already. The thing is, during your training, maybe you just decided you wanted to learn a little bit more and see more diseases and be more confident in it. So that's when people would do that residency, and it definitely helps if you end up wanting to go into specific settings. For example, like in a private practice like I am now, you kind of see a little bit of everything. And then so that information is probably used, but probably not quite to the same degree as if you decided you wanted to be working with an ophthalmologist. And so they're, every day they're seeing diseases, treating them, and then doing surgeries as well. So that's where it might come in more handy. Um, Other than that, some other popular ones, I would say pediatrics. You can specialize in contact lenses. So we have our usual soft contact lenses, but there are also a lot of customized special contact lenses. Usually they're more rigid, but those can, they can help with controlling your prescription. If you have very high prescription, you put those contacts on at a young age, they tend to kind of slow down the progression of any sort of nearsightedness. There are diseases, a lot of diseases that affect either the surface of the eye or one of the medias of the eye. And then so a contact lens sometimes can be the only way to give someone 20/20 vision. So contact lenses, I would say, is a pretty popular residency as well. Other than that, there are things like traumatic brain injury, there's low vision. So low vision, you would be working with patients who are visually impaired, meaning they're probably seeing 20/200 or less. And then so for them, it's very rewarding work because you get to really look at someone's lifestyle, and they might not be able to see the numbers on a microwave, or they might not be able to safely cross the street, and you're able to provide um, tips and devices and things that can help them kind of just try to live as normal of a life as possible. There's also, there's so many. And the last one I'll mention is just vision therapy. So that one is kind of like physical therapy for your eyes. So, if people have eye turns, or uh, their ability to focus their eyes or track them isn't quite as good, with therapy, you're able to kind of learn how to control your eyes better. For myself, I actually had to do vision therapy too, because I used to actually see double from studying so much, and so therapy actually helped me kind of get over that. So yeah, that's kind of the beauty of optometry as well, that there's so many different ways you can practice, and you don't necessarily need a residency for all of those. After just those 4 years, you have enough knowledge usually, and then you are learning on the job as well, that you can just go into those fields um, and really just do what you want.
Sounds awesome. I didn't really know there was so many different options within optometry, because my only real experience is going to optometrist since I was in like first grade, but I never really thought about, oh, you can specialize in traumatic brain injury or something like that. So that's
Mm-hmm.
pretty eye-opening to me.
Yeah, I like that pun you did there.
Non-intentional.
I see.
So this is a little bit more personal of a question,
Mm-hmm.
but how do you think this career has changed you as a person, if it has changed you?
I would say, I went in really wanting to be able to help people. And so it's been very rewarding and gratifying to be able to do that. So I think it hasn't really changed my overall goals in terms of what I wanted to do, which was, be able to serve my community. Uh, I would say that it's definitely helped me value my relationships more, because like I said, you really are meeting so many people every day from different walks of life, and I believe that every interaction that you have, there's a value to it, and you can learn something from everyone. And so I feel like I've definitely had a lot of good life lessons from my patients, especially, before when I did a residency, I was at a veterans hospital. And so, you're working with people who have gone through a lot. They're usually pretty wise. And then so, yeah, definitely a lot of good life lessons. And, it also taught me to value my relationships with my family as well, just because you do have the flexibility and you can always say, I can go home. I don't have to think about work anymore. I can change my schedule so that I can be with my family. And so that the ability to have that work-life balance has allowed me to continue to value my relationships both with my patients and at home.
Yeah, I think that sounds like a pretty good answer. And on the flip side of that, can you think of any like downsides of this career or maybe regrets you have like going into this career?
Sure. For myself, I have no regrets of going into this field. This was kind of my dream job once I discovered it. And like I said, it's just so rewarding. I would say some downsides though would be probably the big one is student loans. So for most people in my graduating class, I would say probably the average amount of student loans that we leave school with, including, any sort of debt from undergrad, we're probably looking around, 160 to 200,000, assuming that you take loans out pretty much every quarter. So it definitely does add up. I mean, hopefully for you guys, there's going to be some new changes in the way things are, and loans won't be as much of a financial burden for you guys. But I think it definitely can be a deterrent. It's similar to medical school too in terms of the debt. But if you think about the salary that you get as an optometrist, if you are getting into the same debt as medical school, technically your salary, you're probably not going to be getting the same salary as an MD would be getting. So I would say that is a downside. You'd probably only be getting closer to an equivalent salary if you're like a practice owner yourself.
All right. Well, I think that's kind of with all like college careers these days, especially as the job market gets more competitive. You're seeing like kids having to go to get a master's program before they can even get hired for jobs that would normally require a bachelor's. So across the board. But based on the upsides that you've mentioned, like getting the family life and the flexibility and having that opportunity to develop a relationship with your patients, I think those pros outweigh the cons, at least for me.
So have I convinced you? Are you going to be an optometrist?
We'll see. We'll see. um, Getting back to like job in general, are
Sure.
there any notable like promotions for this career, or is it kind of a non issue or something that's not really common?
I think it's kind of tough to say because promotions, I feel like I usually think of kind of your typical job where you're in a big company and there's multiple titles and you can just kind of work your way up a ladder. And so with optometry, I guess it's both good and bad that it doesn't really work that way. So I mean, once you graduate, you are an OD, you're a doctor of optometry, and everyone else you're going to be working with is going to be an OD as well, and you're all kind of on the same playing field, except some might have more experience than others depending on how long you've been practicing. um, so yeah, so that could be a pro or a con there. I would say it's not necessarily promotion, but I think there are still always further things you can achieve, which is nice. So for one thing, the residency is something you can do afterwards. If you decide that you want to keep learning, you can do that. um, And so for myself, after the residency, I'm now trying to do a fellowship with the American Academy of Optometry. And then so, you may present lectures, you write case reports, and then kind of like defending a thesis, you kind of have to sit for oral exams as well. And then you become a fellow of that National Academy, just to kind of show your dedication to learning. And there's a lot of things like that where you can kind of gear your interest a certain direction. Like if you're interested in the contact lenses, they have a fellowship specifically for that as well. So there's different things that you can continue to look into and then try to grow with.
Yeah, and then you are also mentioning about opening up your own private practice, or like that's a goal for people in your field. All right. So the last question that I have is, how would a student get started in this career? Are there internships available, or is this something you really have to start while you're in college?
So I can tell you a little bit about how I started. I did a lot of volunteering with vision screenings, and so there's usually like a couple of big names that just kind of do it locally throughout California. Probably not now during this time, but eventually they'll start doing that again. I shadowed optometrists locally, and then so you can just email any optometrist that live nearby, or they practice in a certain way that you are interested in. And then so I would say usually doctors are pretty open about that. You would just sit in there during their exams for half a day or a day, just so you get an idea of exactly what a day in the life of an optometrist is like. And so that definitely helps you figure out whether that sort of lifestyle is something that suits you. So shadowing is also how I ended up getting my internship. So a lot of the times, if you shadow or you just express interest, you can, either volunteer or get paid and have an actual job at their office as a technician. And so that really helps in terms of, one, confirming what you want to do, because you're going to be in that setting all the time. And two, just in terms of things like future letters of recommendations, and just being able to put that on your resume, it is very helpful. So I would say those are kind of the first steps that you would take. And then in terms of your studies, if you are in any sort of health science field, for the most part, it's probably going to take care of most of your prerequisites for optometry school already. And that information is available on a lot of websites, so that you can figure out exactly what those courses are. So I would say that's probably how you would get started and determine whether optometry is something for you.
Before we end up the career, is there anything else that you think interested students should know about this field?
I feel like I've said it all, but I'll just say it again. I really think that optometry is a very rewarding career. If you are looking for something in the healthcare field, there are really so many options, and every one of them is going to be rewarding in one way or another. Being in this field particularly really gives you a chance to make very strong bonds with your patient. You have this, immediate gratification of knowing when you're able to give them clear vision once they put on their glasses. If you make their life easier for things like sports, if you give them contacts, if you catch diseases that otherwise may have gone undetected. So, if you pair all of that with the fact that you have this very nice work-life balance, and you're still able to prioritize the things in your life that matter, you don't become just a zombie that works 9 to 5. I feel like optometry is a really great career.
All right, awesome. Thank you again for doing this interview, Dr. Nguyen. And if students have any questions, I'll be sure to list your contact information. And if they have anything, they can always reach out to you.
Yes, that would be perfect. I'd be happy to hear from anyone.
All right, thank you.
Thank you. Bye.